My name is Barry Finette. I'm the founder of ThinkMD. I'm also a professor of pediatrics and emergency and critical care. My passion for medicine came early on from personal health experiences, many of them actually. When I was 11, walking home from school, I developed abdominal pain, and quickly I was unable to actually move off or get off a couch at home. My mother at the time was pretty preoccupied getting my sister ready for her school prom, but she decided to call my pediatrician, who, in very unpolitical terms, suggested to take me immediately to an emergency room. And there I was found to have a ruptured appendix and septicemia. But I was really lucky. I was lucky my mother had the ability to call a pediatrician who was able to identify me being sick, and I was able to receive treatment. But most people in the world do not have access to healthcare. A vast majority don't. And this is a major global problem in many different areas. So for example, in pediatrics, there are 6 million children who die every year who are less than 5 years of age in low and middle income countries. Of these, 50%, or 8,000 children per day, die from purely preventable diseases. Purely preventable diseases like respiratory distress and dehydration. But we're looking to change this. We're looking to change this by developing technology that transfers how a physician's skill sets and information that they have into the hand of everybody, anywhere. And so how do we do this? How do we do this? So a physician, when they walk into a room and examine a patient, is a data gathering, interpreting machine. They gather patient information on demographics, how old they are. They get information if the child, the current and past history. Are they coughing? Do they have vomiting? Do they have diarrhea? And how frequently? Then they gather vital signs, temperature, weights. They even go ahead and determine heart rate and respiratory rate. Now this is challenging with people. When you want to put this technology in the hands of everybody anywhere, how do you do that when they may not have a watch, they don't have a timer, they may not be able to do addition and subtraction? We're able to develop certain technologies that can do that. Then the physician goes to physical examinations. They will check skin turgor for dehydration. They will check pitting edema for malnutrition. They'll look at patients' eyes, called conjunctival pallor, to screen for anemia. They'll also look for nasal flaring, retractions, look for respiratory distress. This is the type of technology that we've built. And then when that data is all collected, a physician interprets that data relative to normal and how severe it is, and then they do an integrative assessment. And that's exactly what we built. We tested this technology for over 2 years in the United States, Ecuador, Peru, Burkina Faso, and Bangladesh. We put it in the hands of frontline community healthcare workers where they were trained in a matter of hours. And they were able to generate clinical assessments and triage assessments that correlated to local physicians seeing the same patients between 85 and over 95%. This technology has been studied and has been included into WHO Compendium for Health Innovations for Low and Middle Income Countries. And the validation studies we've been doing are currently being published in the American Journal of Tropical Medicine and Hygiene. Also central to our core is collecting data and analyzing that data. With every encounter, we collect over 1,000 data points that can be used for user and program monitoring and evaluation, population health analysis, as well as predictive disease modeling. We also have developed it in a way that we can learn from all the data we get to improve our clinical logic, and we're now in a position to do this through machine learning. So does this have any healthcare capacity, or what is the impact of this technology? So over the last 2 years in Nigeria, and implementations in Nigeria and Bangladesh, we've actually been shown that our users, our community healthcare worker users, can increase the number of encounters they do by over 2-fold and sustain this. They go to 2 to 8-fold increase in the number of counselings that they do. There's a dramatic increase in maintaining and adhering to WHO health guidelines, including greater than 40% increase in danger sign acquisition. And we can do this all at a decreased cost. Not only that, our net promoter score from users is well over 80% everywhere we work. The interesting thing and real power of some of the technology we're building is that with minimal configurations, we've expanded our users besides the community healthcare worker. We currently have our technology in the hands of nurses, pharmacists, teachers, and now most recently direct to consumers through collaborations we have with mobile operators. So we're able to actually expand our private sector implementers and now our private sector implementers in the mobile operator space in Africa. So what does this do? This actually allows us to scale. And by the end of 2019, we're projecting to be in between 10 and 12 countries, have over 1 million users, and have over 50 million people have access to our technology, specifically through our mobile operator capabilities. And so we actually do have an ask. We're looking for growth capital to actually take advantage of these opportunities in the next 12 months. So we're very excited of where we've been and where we're going. We're just getting started as a company. We're looking for partners who actually have a core similarities and a belief in the core mission that we have, that anybody living anywhere in the world has the right to live a healthy and happy life. Thank you.